Hey guys, I am Aniket Katkar. Today I am here to discuss with you the information about the technical topic, the causality assessment. Basically, the causality assessment is the systemic process which is used to determine whether a specific exposure or the intervention has caused an observed outcome, particularly in these fields like medicines, epidemiology, and the social sciences. The understanding causality is crucial for effective decision making, policy formulation, and the risk management. Now we will discuss about the concept of the causality. Basically, the causality implies a cause and effect relationship where the one event cause which leads to the another event means the effect. Establishing the causality involves more than just the observing a correct correlation. It requires the demonstrating that the cause directly influences the effect. The second is the importance of the causality assessment. The importance of causality assessment which help in the medical research, then identifying the effects of the drug, treatments, or the environmental factors on health and the outcomes of the health. The public health, which involves the understanding the risk factors for diseases to implement or to prevent the measures such as the policy making, informing the legislation and guidelines based on the evidence of the causal relationship. Then the methods of the causality assessment involves several methodologies such as that exist for the accessing causality, including the Bradford Hill criteria, then a set of the 9 criteria that help to evaluate the causation, including the strength, consistency, specificity, then the temporality, biological gradient, possibility, coherence, and the experiment and the analogy. Then the next is the coach postulates, which is originally designed for infectious disease. These criteria help to establish a causal relationship between a microbe and the disease. Then we will discuss next the counterfactual reasoning. The counterfactual reasoning involves the considering what would happen if the exposure didn't occur or often used in the randomized control trials means the RTCs. The last method is the statistical method that involves the techniques like the regression analysis and the causal inference models. Example, the directed acyclic graphs that can identify causal relationship in the observational data. The next we will discuss the challenges faced in the causality assessment. The first challenge in the causality assessment is the confounding variables, means the other factors may influence the outcome and complicating the determination of the direct causal link. Then the bias, means the selection bias, the information bias and recall bias can distort the findings. The temporal relationships, which are the established that cause the precedes effect, which is essential but can be different and difficult in the observational studies. Next is the complex interactions. Many outcomes are influenced by the multiple factors such as decision making that makes it challenging to isolate the individual's causal effects. The next is the fifth, the applications of the causality assessment. The applications involve the drug development. In clinical trials, the assessing whether a drug causes a specific health condition or health improvement or the side effect. Then the second application is the epidemiology, means the investigating the relationship between the lifestyle factors like smoking or diet and the health outcomes. The third is the social sciences, means evaluating the impact of the educational purposes or the programs or policy changes on the society behavior or economic conditions. The last is the we will discuss the conclusion of the causality assessment. The causality assessment is the fundamental aspect of the research across the disciplines. A rigorous approach to determining the causation enables more effective interventions and the policies that can significantly improve the health of the patient or and the well-being. As these methodologies continue to evolve, the integration of the statistical tools and conceptual frameworks will enhance our understandings of the complex causal relationship. This was the information about the causality assessment. Thank you guys.